Good morning. My name is Dr. Stormy Monks, and I want to welcome you today to our Grand Rounds presentation hosted by the Southwest Center for Pediatric Environmental Health. So the Southwest Center for Pediatric Environmental Health is one of 10 pediatric environmental health specialty units, also known as PACUs in the United States. The purpose of the PACU program is to serve as a leading national source of medical information and consultative advice on environmental conditions that influence human health through reproduction and pediatric development. To serve part of our mission, we offer this Grand Round series once a month on the third Thursday of each month. We are grateful that you've joined us today to hear Dr. Scott Crawford speak on the heat index and health effects of extreme weather. Before moving on, I just want to make sure that you all are aware of some housekeeping items. You will not be able to unmute yourself, nor will you be able to share your video screen. And so we ask that if you have any comments or questions, to please put them into the chat, and we will get to them at the end of the presentation. We would like to thank our partners at the U.S. Environmental Protection Agency, the CDC Agency for Toxic Substances and Disease Registry, as well as the Public Health Institute. Without these organizations, the work of the PACU would not exist. I want to let you know that you are able to claim continuing nursing education as well as continuing medical education hours. The first slide here is our disclosure form for nursing credits. And then our second slide here is a QR code. And this slide also tells us the activity code that you'll need to put in order to claim your credit, which is 4021. Don't worry, we will put all of this into the chat during the presentation, but just so you all know, our activity code for today is 4021. Our next Grand Rounds is on April 17th at 11 a.m. Mountain Time. We will be talking about marijuana use among youth. This will be presented by Laura Kidwell, who is an epidemiologist with the Oklahoma Mental Health and Substance Abuse Unit. We offer many trainings, many different types of trainings. We just want to make you all aware that we have 2 trainings on pesticide use and childhood cancer that we are regularly scheduling. If you are interested in finding out about either of these 2 trainings, please email us and we will be happy to get back with you. We will make sure that our email address is in the chat during the presentation today. So without further ado, I would like to thank Dr. Scott Crawford for being with us. He is an associate professor in the Department of Emergency Medicine at the Paulo Foster School of Medicine at Texas Tech University Health Sciences Center, El Paso. He's also the executive director of the Training and Educational Center for Healthcare Simulation. In addition to his faculty positions, he serves as our educational technology core collaborator, and he has been with the PACU for over 11 years. He is a wonderful speaker, and today we will have the honor to hear him talk about the heat index and health effects related to extreme weather. So, Dr. Crawford, thank you.
So thank you again for having me come and speak. I'm excited to share about the health effects of extreme weather and a few updates that have started coming out in the literature and that have been added into this presentation over the past several years. So during the course of the presentation, we're going to be describing the scope and trends in global temperatures and some adjustments that occur within regional microclimates. going to describe the physiologic health effects of extreme heat to different at-risk populations and outline some of the support and public health programs that can assist with that, and then recommend some evidence-based treatment for patients with heat-related illness and specifically core temperature elevation. So probably don't need to tell many of you that are listening in that it seems to be getting hotter more frequently and with longer duration over the past several years. And it is also not been a surprise for quite a while that heat is one of our biggest risks for overall death as a weather-related phenomenon within the US, and this is also true globally. So our 30-year average has been shown here at almost 200 deaths per year, but we've seen in 2023 a big jump in that relative to many of these other weather phenomena. And I also want to point out that the other items that are listed here that are separated from heat actually end up having some significant overlap with heat in terms of their overall ability to have these devastating effects. And so we'll talk about that in just a little bit. And it's impossible to mention some of these climatic issues now without discussing some of the other just economic costs associated with them. And so we can see extreme weather events happening all over the US, causing enormous impact economically in the form of tornadoes and extreme rain and hail. And all of these end up, again, having some connection back with heat and extreme variations in climatic events. So this graph here is actually a demonstration of the relative change both up and down from the historical norm of averages of the same temperature during this week, averaged between 2001 and 2010. And so what I want you to take away from this is not just that the entire map is red, which it is not. There are sections that are significantly warmer as well as sections that are significantly cooler than might be expected during this time, given a prior comparison. And so these extremes, both up and down, are contributing to human health effects in a variety of ways. And regardless of what you call it, whether it is global warming or climate change, or what we are currently referring to it as extreme weather events, they all end up having significant health impacts. And the term extreme weather simply refers to a weather phenomena that is in an extreme of a historical distribution. So specifically, extreme heat events are periods of summertime weather that are substantially hotter and more humid, than typical for a given location at that time of year. And this can have effects not only on individual people and public health, but as we also saw in that opening slide of the other economic impacts, it can also cause huge impacts on crop, water supplies, and overall infrastructure. So I'd like to share a starting anecdote about some of these extreme heat events in one of the most unlikely locations, and that is in Chicago. And that's because this still has a notoriety as one of the worst heat-related events in the US. So Chicago in July of 1995 had extreme heat, both with high air temperatures and dew point that ended up holding the heat index in the city and the region over 100 degrees Fahrenheit for 5 days in a row from July 12th to the 16th. And on the 13th and 14th, during that time, the heat index actually was greater than 115. This period ended up leading to what was later calculated to be over 600 heat-related fatalities in that Chicago area and over 1,000 in the larger heat wave region. And this was specifically blamed on the concept of the heat island effect. And we'll talk about that a little bit more. But the idea that the heat in the city with all the industrialized space allowed temperatures to maintain much higher than normal without any nighttime cooling. And so repetitive high temperature days led to even warmer temperatures in this region than what might have occurred previously. Another example I like to share is from Chicago as well, but this one in 2004, and not in the middle of the summer, but actually in October. And this touches on the idea of acclimatization. So this was the morning of the Chicago Marathon, normally a very cool and temperate time of year. And it actually had a brief period of quite warm weather that began only a day or two ahead of this start. So people training were getting acclimatized in temperatures of 50 and 60 degrees. And on the race day at 11 a.m., the temperature was 88 degrees, and there were over 35,000 runners. And I know this because I was one of them. At mile 25, there was a police officer standing in the middle of the road, waving his arms, saying, stop running, the race is canceled. I could literally see the finish line over his hands. The reason for this cancellation was actually very important. There were still very many people still out on the course who were not acclimatized to the temperature. The temperature itself was dangerous, as we'll talk about in just a little bit. And even well-conditioned runners were beginning to experience health effects of this temperature anomaly because of that lack of acclimatization, as well as the overall temperature itself. And the race providers didn't have the infrastructure set up and were running out of water at aid stations. Here is just another example. If you needed more proof that it does seem to be getting warmer, that's because based on actual observational measurements, it is. Earth's average surface temperature in 2024 was the warmest on record since we began record keeping in 1880. And overall Earth was about 2.65 degrees Fahrenheit, or almost 1.5 degrees Celsius warmer in 2024 than the pre-industrial average from 1850 to 1900. And the 10 most recent years are the warmest on record, as you can see in this graph. So we are concerned for these continued changes and starting to look much more carefully at what it's going to mean for us as a society and as individual populations. This is not just a US phenomenon, and unfortunately here is information that was published in Nature Medicine in 2023 related to the extreme heat in Europe in the summer of 2022 that saw over 70,000 this is actually comparing two separate things. In 2003, there were 70,000 deaths from extreme temperatures in Europe, and they estimated a little over 61,000 deaths in Europe between May 30th and September 4th of 2022, with the largest numbers in Italy at 18,000, Spain at 11,000, and Germany at 8,000, but the largest per capita impact in Italy, Greece, Spain, and Portugal. So we can see that there may be some features within those countries that allowed for lower overall per capita heat burden impact. And so what we're seeing is the concept of heat waves, and that's when these high pressure areas sort of form and the air lofts up at the 10,000 to 25,000 foot area in height in our atmosphere and strengthens with additional heat and ends up staying over that area and blocking additional weather patterns from coming in. And this can last for several days to several weeks. And of course, most common, therefore, in the summer, both in the northern and southern hemisphere, and described as how the jet stream follows the sun. So that's our initial problem, is these larger geographic issues that may be over several states. But then within individual regions, particularly those with extra industrialization and pavement, cement, buildings, and infrastructure, the heat can be trapped And one estimate was that a city with 1 million people can have as much as a 5-degree Fahrenheit increase in that city compared to surrounding sort of natural environments. And in the evening, this difference can actually be as high as 22 degrees Fahrenheit, preventing that cooling effect. And that, again, is what was believed to be the major contributing factor for the extreme temperatures and mortality that occurred in Chicago in 1995. Within individual areas, we also see the idea of microclimates. So these are small changes within individual neighborhoods that can affect things like where parks are placed or the shape and orientation and size of individual buildings. Maybe having a large stadium in an area that could block wind or airflow through certain features, and even smaller topography features like hills can all change the overall microclimates. And these, again, can have significant impact relative to other areas. One other term that I'll introduce here is that of albedo, and that is the idea that individual building materials and shapes can have changes in reflectivity and heat absorbance relative to other materials and surface. Um, and so the concept of roof color and building geometry are being used now to help in adjusting these regional microclimates and to help prevent some of these urban heat island effects, and are an important feature of larger public policy. Uh, During our daytime temperature changes, particularly with solar radiation, the type of ground cover ends up also being an important feature, with bare concrete being hotter than lawn, being hotter than water or the shade of trees um, during that bright sunny time of day. And that is overall reversed then in the nighttime, with ranges again up to 5 degrees per difference between these two areas, and that 5 degrees is in Fahrenheit. So now we'll talk about a few different ways of describing heat. And I, growing up in Tucson and now being in El Paso, I'm very familiar with the concept of, oh, it's a dry heat. And here is proof that there is actually some uh, actual data behind that. And so here we see humidity on the left and temperature across the top of this graph. So heat index is also sometimes referred to as apparent temperature, and this is what the temperature feels like to the human body relative to the humidity. But interestingly, this is measured and calculated in the shade, which is a very important consideration because very few workers or people who are exercising will do so exclusively in the shade. And so the heat index ends up not being as useful a marker for the potential risk for being outside in these temperatures or conducting physical activity. And even so, heat index is still used and can help to provide some of these gradations of potential caution that, in non-acclimatized individuals, that a heat index in the 80 to 90 range is still possible to generate fatigue and prolonged exposure during physical activity, whereas up to 125-degree heat index, so to be either a very warm or warm and humid area, that heat stroke becomes, quote, highly likely, as their description here. The part that I mentioned again, though, is that this is in shady locations, and in direct sunlight, these values may actually be increased by as much as 15 degrees Fahrenheit. And so what do we use to help with calculating that on these larger areas, or sorry, in these more practical applications where we're looking at the human physiologic effect in warm temperatures, and that is the wet bulb globe temperature. So this is a combination of 3 different temperature measurements, as shown in this image of a wet bulb globe temperature monitor. So there is a dry ambient temperature thermometer labeled there. and that is simply the ambient temperature. Then the wet temperature has actually a piece of wet cloth generally, and will measure the effect of evaporative cooling on the temperature sensor in that middle section. And so, if there is lots of wind and a relatively low humidity, that wet temperature may drop significantly, allowing for the measuring the effect of evaporative cooling on a active person who is perspiring. And finally, the globe that is measured here on the end uh, will detect the effects of solar radiation on a person. And so these will also vary depending on the location where you are. So it's recommended to actually have a device like this nearby where somebody might be exercising or working to get an accurate wet bulb globe temperature measurement to make recommendations about how to adjust or modify activity based on these numbers. It's also recommended that this measurement be taken about 5 feet above the ground, as that is the estimate of, again, the human physiologic interaction with the heat environment. And so here we see a separate graph talking about wet bulb globe temperature and its overall impact and what type of exercise limitations should be put in place. Um, So here, and that final column can be a little bit confusing. In that 80 to 85, you would want about 1/4 of the time to be spent taking a break if you are doing any type of exercise. Whereas if it gets over 90, that you would want to have 3/4 of your time during an hour be spent taking a break and rehydrating. So you can see these big differences um, even at what many might consider to be relatively low overall wet bulb globe temperature measurements. There have been quite a few studies looking at the overall health effect and the overall health effect that is occurring within individuals um, and across populations based on weather phenomenon. And so this is showing some of those different types of phenomenon being described with infectious disease being one of the largest on the left, and that's broken down within extreme weather in red and meteorologic changes or causes in blue underneath that as the two categories. The reason I show this is to actually bring your attention down towards the middle, but one of the largest extreme weather impacts is on mental health. And this is important as a consideration in human health beyond just the temperature physiologic changes that we think about. And that's because of the great changes that it has on our surrounding environment and our ability to function as a society with things like stress on um, infrastructure and crops, as well as our home environments. We've seen all kinds of news stories about temperature and weather extremes. Here's an example of the Tulare Basin in California from 2023. This was a basin that had actually become dry for over 75 years and was now a large agricultural area, but because of extreme rainfall, actually accumulated enough water to essentially reform a lake that hadn't been present in over 75 years. We are seeing tornadoes occurring earlier and earlier in various seasons, with March to um, March to October having the largest number of tornadoes across the US. And there is growing evidence that warming climate may actually make tornadoes occur earlier and extend later and with greater severity. And we're seeing trend lines like this, where the overall number of tornadoes that are being recorded increasing over time, again, corresponding to or correlating with increased temperatures. And we see lots of stories about increased flooding, and this is because warm weather conditions allow more rainfall and more moisture to be trapped and carried within cloud systems. And we're seeing stronger and earlier hurricanes as well. So increased frequency and severity of tropical storms and hurricanes are also expected to be secondary to these larger um, uh, temperature extremes and contributing to the overall health effects. Which leads us back to our discussion now about mental health. Uh, this is not a new phenomenon, considering that the overall stress and mental health impacts um, because of extreme weather events. And in 2007, there was a term coined in the Australasian Psychiatry Journal called zoestalgia. And zoestalgia is the distress that is produced by environmental change impacting on people while they are directly connected to their home environment. So people exposed to environmental change experience negative affect that is exacerbated by a sense of powerlessness or lack of control over the unfolding change process. And we can certainly understand how something like this could exist as a concept. We're seeing more frequent droughts, wildfires. The wildfires can lead to secondary complications, such as risk of flooding because of the loss of root structure and soil containment after the trees have died, even years later. And we're seeing things like larger floods with secondary mobilization of chemicals from the soil being washed down into areas where drinking water is being pulled out, and then secondary mudslides and other things that are causing these large health effects, as well as the zoestalgia and impact on our home environments. So if we're not concerned or experiencing zoestalgia already based on what I've shared, we'll now share some of the other risks that are going along with uh, uh, environmental changes that we are seeing potentially impacting our lives. Mosquito-borne diseases and other zoonotic diseases, such as dengue and chikungunya and Zika, malaria, are all expected to increase with higher overall global temperatures. The absence of cold weather in certain areas can now allow these species to overwinter and is increasing the overall availability of territory where they can survive. We're also seeing similar trends with tick-borne diseases that are particularly seasonal or impacted by temperature patterns. So here was one study back in 2017 that suggested that mosquito transmission of disease increases in higher temperatures, and that is likely to start impacting the Rio Grande Valley with higher temperatures in Texas here. It also, in July of 2023, the Morbidity and Mortality Weekly report from the CDC described a hospital in Texas that confirmed a malaria Vivax a diagnosis in a patient who did not have any known travel risk factors. And so this was reported to the Texas Department of State Health Services. This is not the first case that of malaria ever that was autochronously occurring in this region, but it was the first one since 1994. And so there's certainly lots of public health and epidemiologic studies looking at if this is going to become a increasing trend and how to try and help prevent that. We're also seeing that this was just a standard news story out of Oklahoma, that there seemed to be an increased number of pests, specifically mice and rats, in the Oklahoma area north of Oklahoma City. But there may be some significant and scientific backing to this phenomenon, where we are seeing that there may be higher rat numbers in cities across the US that are linked to climatic change and warming and urbanization with human population overlap with these environments. And one of the ones that has recently gained some public interest and at least notation again is that of hantavirus. And that is because it is believed to be the causative agent for the death of Betsy Arakawa, or also better known possibly as Gene Hackman's wife, who just a few weeks ago was believed to have died from complications from a hantavirus infection. And we're seeing that this may be increasing in frequency now because of temperature changes, but it is still primarily within these areas as seen with patterns from its origination as a discovery of a disease in 1993 through the 2022 year shown on the map. So mosquitoes, sandflies, ticks, all of these are expected to carry additional zoonotic diseases, as well as some of the others that I've mentioned. And the overlap between temperature and human health effects has been looked at for quite a while, and we are certainly going to continue to see more overlap with how crop yields and physiologic health effects, as well as these infectious disease risks, will occur as weather patterns continue to demonstrate higher extremes and are going to impact our lives more and more as we have a expanding population. So as we look at our individual populations, it's important to also note who is going to be at risk of these physiologic health effects that are directly associated with temperature and heat. So those are going to be specifically individuals that have difficulty with thermoregulation or that don't have the option to seek shelter or cooling in other areas. So the elderly, those over the age of 65, have an exacerbation of heat mortality compared to other portions of the population, likely related to underlying cardiovascular, cerebrovascular, and respiratory diseases that are made worse with heat conditions, as well as other comorbidities, particularly those that might be treated with medications. We also need to remember that the homeless or those that are not able to escape heat are also more vulnerable, and this includes children, especially under age 5, as generally this range is unable to take measures to protect themselves from extreme temperatures. And so we would need to make sure that we're looking out for and protecting this population. And it's more than just getting out of the heat and into an air-conditioned house. We're seeing that there's an increase in pediatric emergency department visits based on temperature correlations, things like dehydration and electrolyte changes that we would expect, but also things like bacterial enteritis and otitis media and external have increased relative risks as temperatures go up. Also, those with who take medications that may adjust thermoregulatory balance. So anybody with chronic diseases is likely to have higher risk of adverse health events because of high temperatures. And pregnant women have a specific risk as well. There have been multiple associations of low birth weight and preterm delivery with increased temperature during part of the pregnancy level. And this was a study that was published in 2022 looking at Texas jails and prisons. And the current regulations in this article describe that jails are expected to stay between 65 and 85 degrees, but that the same standards did not apply to state and private prisons. And they found that between 2001 and 2019, there were 2,083 deaths in prisons without AC, and 13,081 deaths in those with AC. Now, it's not saying that the temperature directly caused it, but they were able to find a correlation that it appeared that a 1 degree increase above 85 degree heat index on an extreme day was associated with an increased risk of overall mortality and a 15% increased risk in mortality in prisons that did not have air conditioning. So again, just thinking about what these public health measures might need to be to protect these at-risk populations that might not be able to seek shelter or adjust their environmental temperatures on their own. We'll see another graph, or we've seen another graph that looked like this earlier related to the European heat impact from 2022, but you see this dual peak both in the very young and very old, looking at the those that are going to be more susceptible to heat-related death in these extremes that are going to be unable to have the physiologic reserve and thermoregulatory balance. One of the interesting things on this graph relative to the other is that males are at highest risk across all age cut points, whereas actually in the European study, some of the very extremes in age had a preference for female risk, although you'll notice that this graph does not go above 64 years of age. The European graph did and found specifically that women in their 80s were one of the higher risk groups there. So what can we do to help with all of these potential issues, of which I have now mentioned quite a few? And the goal with this is not to try and depress anybody, but to simply make you aware of the potential issues so that you can take steps to advocate for appropriate public health measures for protection of yourselves and other populations that you will be caring for. And then also in the final section that we'll talk about in a moment, some specific tips on how to provide medical care to those who are experiencing extreme heat-related issues. So some of the most important things are going to be a combination of education, surveillance, and predictive modeling to try and help decrease the overall impact. So the health impact of mortality and morbidity due to heat waves. We want to work on the public health education, something like what I'm providing to you here, but then also developing heat warning systems and emergency preparedness plans that combine information to provide this sort of syndromic surveillance. Some of the other things that I have seen as ideas include sunscreen community provisions, so making this available at public parks to try and decrease the burden of disease from solar and UV radiation. Larger cities opening up cooling centers due to extreme heat, as shown in the example here from this news article from Little Rock, Arkansas. But it's not just opening the cooling center. Again, our biggest risk is for those who might be either elderly or non-domicile and not have the ability to get to a cooling center. So also setting up busing or transportation systems if a center like this is going to be established. We also want to consider and look at acclimatization, and that is identifying not just the temperature in a region or at a given time, but how much that temperature varied from other time periods that were similar and relative to the progression, like the Chicago Marathon example. If the temperature had been very warm for the preceding several weeks leading up to that event, it might not have been as much of an issue as the single day in the upper 80s after spending much time in the much lower temperatures leading into that, where bodies weren't able to acclimatize and change the overall composition of sweat and other things. Particulate matter is expected to increase during heat waves, and this can affect asthma and other lung disease. And an interesting study out of South Korea, particularly for those who have been in El Paso over the past couple of weeks and seen our wonderful air quality, where I think visibility was reduced to about 100 yards last week. We in South Korea, they identified that on days with PM 2.5 elevations, that 2 to 3 days following that, they were actually able to identify a increase in spontaneous pneumothoraces. So green space is one of the things that we can do to combat this health effect, that green space can both lower regional temperatures and has also been shown to decrease particulate matter. So we want to encourage programs that would allow for this to decrease both of those risks. And the National Oceanic and Atmospheric Administration has come up with a scoring category for heat risk. And rather than trying to figure out all of those different heat indexes and the wet bulb globe temperature that are also very well categorized by color, this is a very simple scoring system that you might see as a risk. And just today is a red risk day because of high temperature, and those who are sensitive to heat might not want to go out or seek additional cooling measures. So this has been one of the issues that has been highlighted around this topic, is the lack of consistency between studies, as we have been trying to find a consistent way of identifying and measuring and providing notification to the public about how to approach heat days or heat events. Which brings us to our syndromic surveillance. This is the concept that if you have appropriate data sources, whether it is combinations of temperature and wet bulb globe temperature measurements, as well as even pulling in data about the number and type of presentation to healthcare facilities, that you might be able to develop the larger system architecture to look at those data sources to create a definition of what you're looking for, such as an extreme heat event that is causing physiologic changes, and identify what those rules are so that you can then provide information out to the population or to healthcare facilities to modify their practice or to increase their ability to bring in equipment, supplies, personnel, whatever it is, to be better able to provide care during these events that are identified by a specific syndromic surveillance system. An example of that was given in this study in 2017 out of Maricopa County in Arizona, that looked at things like diagnosis code, chief complaint text terms, along with some specific exclusion criteria. And they were able to use this to help identify specific heat season onset between May and September with greater accuracy than using their previous systems. So we're expecting to see the impact of climate change on human health affecting all of these different areas. So we're having potentially rising sea levels, more extreme weather, rising temperatures, and all of these are going to impact all of these other areas that we're seeing. So we want to make sure that we are keeping these in mind as we are building our educational systems to represent and recognize this within both the healthcare environment, but also the larger public health and public policy systems. So now we're going to get into heat syndromes and management. This will be the specific physiologic discussion section, and that talks about dehydration and climatization to start. If you're going to be outside for a period of time, particularly in warm weather, the type of clothing that you wear is also going to have an impact on your ability to shed heat, particularly if you are working. So multiple layers of clothing or non-permeable coveralls or protective equipment might decrease your ability to benefit from evaporative cooling that you would see normally on the wet bulb globe temperature measurements. And so you may need to adjust those calculations if you are wearing like firefighters bunker gear or something like that. But if you are able to choose your own clothing, long-sleeved, loose-fitting clothing that still allows for evaporation, and drinking 4 glasses of water per hour spent outside. And the newest recommendations are simply that you should drink until you are not thirsty, that you want to match that then with your overall urine output and the color of your urine, can actually give you a pretty good sense of where you are in terms of your hydration status. And we're obviously looking for that light yellow color shown on the left side of the image here. And anything that gets darker starts to risk the demonstration of dehydration or even extreme dehydration as shown on the graphic. We'll talk briefly about some of these other lesser concerning things like heat rash. This might just be these red clusters of small blisters that look like pimples, usually from sort of irritated sweat glands, and often just staying in a cool, dry place and keeping the rash dry so that the sweat glands don't get irritated is enough to treat these. Sunburn can occur certainly with exposure to solar radiation, and we need to remember sunscreen to help with that. But remember also that simply being in the shade doesn't protect you entirely because of radiation reflecting off of surfaces nearby, particularly water, sand, even concrete. People who are in the shade that may not think they needed protection can still end up with sun exposure, radiation symptoms from sunburn. Heat cramps starts to get into a spectrum of heat-related disease, and this is from excessive sweating that leads to muscle spasms and pain, and is usually from changes in electrolyte composition. So decreasing your overall physical activity and continuing to drink water and or sports drinks. But if it is persistent, doesn't get better with rest, you may need to seek medical attention, and particularly if you have underlying kidney disease or problems with regulating sodium or other electrolytes, you may be at higher risk for this. Heat exhaustion is now on our final set of continuum of the heat morbidity spectrum. So this is going to be usually heavy sweating and feeling of weakness, sometimes nausea, vomiting, dizziness, headache, but basically feeling the effects of heat starting to make you feel ill, but before the progression onto heat stroke, which is hallmarked specifically by altered mental status. Usually with a elevated body temperature of 40 degrees Celsius or higher, but specifically it's that altered mental status. And now we'll talk about a few case discussions here. So if you were walking along outside and you were admiring this nice vehicle and forgot to check the rear seat as the driver exited, and you saw this in the back, the question then is, what would you do? And I'm going to share the news story that was published in Fort Worth in 2017, giving the unfortunate superlative for Texas on yet one other item that for nearly 20 years, more children have died in hot cars in Texas than anywhere else. So in this situation, I might actually recommend reaching out to an emergency authority, a police officer, fire department to break glass and try to actually rescue whether it's an animal or child that is trapped in a hot car, as these can increase in temperature very rapidly and be very life-threatening quite quickly. Now, if we're in the pre-hospital environment, particularly in the for outdoor workers and agricultural or construction areas, maybe athletics, you might have patients that collapse from heat stroke. And what is the best and most appropriate pre-hospital care? Well, we have the military to help with identifying that the absolute best is ice water, cold water immersion. Unfortunately, it's been identified that this is not always feasible, that most people out on a picnic or even at an athletic event don't have a full tub of ice water enough to submerge a patient. And so we've seen a new trend. This one was actually published in 2017 but it's catching a little bit more attention, particularly with the increased media on high temperatures. But TARP-associated cooling, um, and specifically TARP-associated uh, oscillation, is what I have now seen termed, because it allows for the acronym of TACO. So TARP-associated cooling with oscillation is a technique that was described here, where you would place a patient on a sheet or tarp, and in the original study, they would put gallons of ice and water into that space and have several individuals help to roll the patient back and forth within that slurry of ice water to help with cooling. And you can see the effectiveness on the graph there for how quickly it works. I'm going to share briefly about the methods for this, just because I think that it is fascinating how relatively well controlled this was. But I'm not sure that most IRBs would be in support of this. But they actually had participants provided with written informed consent to participate at the University of Connecticut IRB approval. And they exercised on a motorized treadmill in a climate-controlled hot ambient temperature of 39.5 degrees, with elevated relative humidity at 38%, until they reached exercise-induced hyperthermia, specifically at a temperature of 39.9. Or they developed the inability to continue exercising or had an uneven gait. And at that point, they then stepped off the treadmill and were greeted with either passive cooling, as you can see there, or 20 gallons of water and 10 gallons of ice poured onto them in a tarp to assess the effectiveness of rapid cooling. So this is pretty well studied as one of the next best options if you don't have ice water immersion. And hopefully this little clip will play, but it shows an example of how this might really work.
We need to get her in this tarp.
Chris Sampson,
This is
an
shown
emergency medicine
specifically in a
physician at
pre-hospital
University of
environment
Missouri
here,
Healthcare, helps
which is
us
where it might be
demonstrate the
most
TACO
appropriately
method.
implemented.
Now we need to put some ice on her and get water on her as well, and pick up the tarp.
TACO stands for TARP-assisted cooling with oscillation.
The TACO method is very important for people who you may encounter that are confused, unresponsive, or have passed out from the heat and will not wake up. These people often need rapid cooling in order to help save their lives.
If someone is unresponsive, get them onto a tarp. Pour water and ice on top of them. Then keep the tarp moving.
Most of your heat dissipation occurs on the surface of your skin, and by oscillating or moving the tarp back and forth and having that cold water get in contact with all portions of their body, you're able to get the heat off them in a more rapid fashion.
Think of this as a temporary cooling method. You still want to call 911. But taking action before the ambulance arrives could make a life-saving difference. Down.
Let's roll her. We need to get her in this tarp.
Chris.
So again, for pre-hospital, that's actually potentially a very effective way of providing cooling that could be truly life-saving. In the emergency department, however, this has been what our cooling methods have looked like up until just a few years ago. And here we're able to at least highlight the benefits of the 4 different ways of heat transfer. So radiation, or the loss of heat across the skin barrier into the ambient air, so exposing as much of the patient as possible. Increasing that conductive heat transfer, like what was shown in the previous pre-hospital example, or ice water immersion. And so this is packing the groin and axilla and other areas with ice, specifically in areas that are less likely to have vasoconstriction, and then increasing evaporation, so putting lukewarm water across the patient with blowing air. And so you can actually see on the bottom of the screen here, there is a blower hose from one of our devices normally used for heating, but set to not heat, to provide that evaporative cooling. And then the convective portion here, where we have the wind and air currents helping with that. This is actually a patient that I had quite a few years ago, and this was the technique that was most appropriate at the time. But we're now seeing that there may be a way of having something more like the ice water immersion as a more effective method in the emergency department. And so this study here essentially worked at adapting the taco method or the ice water immersion into the emergency department because we don't have large ice water baths that we can put patients into. So in this one, they recommend it for rapid cooling to get under 39 degrees Celsius, that you should still be doing ACLS and evaluation of other injuries. But that the active cooling should not be delayed for procedures like intubation or vasopressor support, and log rolling the patient into a body bag, and then cutting out a hole to help with liquid drainage. And then as you approach that 39-degree Celsius mark, you can actually stop the cooling and get the patient out so you don't overshoot. And so the question then becomes, well, where do you get this much ice in the emergency department? And I had a chance to try out this idea as shown here. We had used up all of the ice available. You can see the crushed ice that came from the drink and water dispenser within the department. But then we were able to send somebody downstairs to the cafeteria who came up with a very large packaged bag of ice that we were able to apply onto the patient in the body bag. I'm going to draw your attention to this next slide here. You can see the temperature probe. That is actually a rectal temperature probe, so it is not sampling the temperature of the ice. It is sampling a core temperature. And if you can see on the very back of the screen there, this patient, even in this condition, is altered and has a temperature of 40.9. Over the next 15 or 20 minutes, the temperature did drop very effectively. And started to take this patient out at about 38.5, which was a little bit lower than I had hoped for. But already by that time, the patient was beginning to respond, talk, and mentate more appropriately. And we had some difficulty, just for those who are ever trying to implement this. We probably could have had a separate bed available to then log roll the patient onto with towels for drying. But we ended up with a slight overshoot, and the core temperature ended up being, I think, in the upper 35s before we were able to fully reverse, and the patient actually was starting to complain of being cold. But I guess that's better than some of the alternatives. So I'm going to jump ahead here because we're right at the time, and just remind that not all temperature elevation at extreme is environmental, and conditions like malignant hyperthermia, drugs, and other toxins could actually go along with this. And one of the examples from that paper talking about the ED implementation of this ice water approach was for a patient that had substance use that was then secondarily found down with environmental heat exposure. And so being sure to address all causes for rapid cooling, but also keep in mind that there can be other contributing factors. So at this point, I will stop the presentation and see if there are questions. I've seen a few come up in the chat. Yeah, so there's a comment earlier on that in Chicago in the 90s, there were very few buildings that would have had centralized air conditioning that contributed. And a potentially concerning link that was put in there about decreased access to water breaks for construction workers. I don't know specifically about that one relative to other things, but that is being looked at by OSHA as a larger federal thing. And certainly we're seeing lots of question marks about federal versus state control for certain regulations, but something to keep in mind and to look out for. In terms of how, there's a question here about how researchers are measuring the impact of extreme weather on mental health. I don't know of a specific metric, but that study was just looking at the patients that were trying to look at patients that were having increases or presentations for mental health related concerns, specifically near or following these larger environmental extreme weather events. So looking at maybe the number of patients presenting or the prevalence of patients presenting with certain mental health, depression, anxiety conditions before and after these events in regions. There's a comment here that says, in Houston, we do focus groups, and we also know of other agencies measuring cortisol shed in wastewater. Oh, that's interesting, as a way of looking at the potential mental health impact. Okay. It says, how at risk are infants when outside, even with shade covering and fans? I see lots of families with young children at the park, very high temperatures with just a stroller shade and small fan. Just curious if being outside is at risk for these small children. So it is potentially, the fan is a nice feature, but as we were seeing, you'd want to take into account that wet bulb globe temperature concept. You may be able to add some moisture, some water to the clothing to help with evaporative cooling, but on very humid days, and if you're actually directly exposed to the sun and you're not getting much shade, there is the potential that that could contribute. And again, a child in a stroller or in a car seat may not be able to control or access their own liquid intake, and that would be one of the big factors that you'd need to look out for. I will work to get the slides prepared for some form of sharing, and we'll also hopefully be able to get this presentation put up on the YouTube site that's been able to hold these other presentations as well, and share that with the group. And it says, would you recommend the taco method for children as well? What process would you defer, assuming that 911 is called as well? So again, the taco method for me, I have not personally done. I have done the modified version in the emergency department, as you saw in a couple of the images. I think it would be fine for children as well. The reason that we are looking at it is if you didn't have an ice water immersion tool. So if you had somebody small enough that you could put them into a large cooler, or at least a portion of their body into a large cooler, you could do that. And this is obviously, as you saw from the technique, not recommended if you have concern for secondary trauma, fall, C-spine injury, as there is absolutely no spinal cord precautions. And so you'd have to fit that into the larger context. But if it's just a exposure without trauma, and you didn't have a vessel with ice water large enough to hold a patient, that's where I would think that the taco method would be most effective. And I see a comment here about the use of fans in very hot environments, that it could actually make things hotter. And again, yes, that's where that wet bulb globe temperature concept comes into place, is you can see what the evaporative cooling effect is with ambient air movement. And so in those particularly humid environments, you may not see any variation. And that's where you would be more concerned about that heat effect, because our physiologic adaptive measures aren't going to be able to help, like evaporation.
Dr. Crawford, before we go, there was one last question. Do you know literature on negative chronic health effects of sustained high temperatures?
I have not specifically come across any literature there. It may exist. I just had not come across it relative to this. As my big focus for the takeaway is I want people to be able to treat acute, life-threatening temperature elevations. But I will keep an eye out if I find anything.
Well, thank you so much, Dr. Crawford. This was an excellent presentation. If anyone has Any further questions for Dr. Crawford, you can definitely get a hold of us and we can get those to him and respond back to you. If you are interested in receiving the slides for this presentation, please also email us. And as Dr. Crawford said, we record all of our presentations and we do have them on a YouTube channel that we host here. So if you need more information on that, also please let us know. I will go ahead and put our email in the chat in case you missed it earlier. But it is SWCPEH, standing for the Southwest Center for Pediatric Environmental Health at ttuhsc.edu. And so everyone should have that. So thank you again, Dr. Crawford. Everyone have a wonderful day.